Okay, this video is about selecting the destination once you decide on weight loss surgery. Now, you had surgery a couple of days ago? 3?
I did, yes.
72 hours?
Yes, 72 hours, and it was fantastic.
How do you feel?
Wonderful. I had the best experience ever.
You-
Staff was great. They're like family.
You just did, we just did your barium swallow and just went right through. That x-ray shows that your stomach is like really small.
Yes.
And you're all excited.
I am. I'm ecstatic, actually.
All right, so you decided to go out of the country for surgery. How did that happen?
I actually went through Instagram and I started watching your live videos, which was really important to me, doing live videos with real people and reviews, hundreds of reviews, certifications, not just ones, but multiple certifications. Yep, 5. So I did do research with others, which there was another doctor who did not have certification, but I knew I was in the best hands, which is you, doctor. So I was very, very, thankful that I chose you.
So what made you think twice when, I understand you had already even booked with the other surgeon or center?
No, I did not book.
Okay.
I was going to, but I did not book. I was
What made you hesitant?
certifications.
Okay.
Board certifications, and no live videos.
All right. Yeah, because we actually do live surgery, and I remember the first time we did a live surgery, Facebook had just announced, you can go live on Facebook, and I said, cool. So since our patients usually have that little, where they sign that we can use the video, I said, go live. And we started doing a surgery, and it was live, and most of the surgeons that look at the surgery were like, you went live with a patient surgery? It's like, yeah, it's educational. We're not actually showing off. We want to share what's going on inside the body. And most of the feedback was like, wow, we didn't think it was this straightforward, this fast, this quick of a recovery. And then a lot of questions happened. So if there's any questions right now, we can answer them. There's a
We
question.
have a question, but for you.
Nice.
They're asking, do you have an Instagram so we can follow your progress if you're comfortable with that?
I do have an
She's
Instagram.
comfortable because
I
I'm
will
going to
go
push her
ahead.
to. I'm going to push her to make this because she said, "I want to share my progress, and you can be an inspiration because she's active. You have all the share that with us."
So yes, I do have an Instagram, and I can post it. I can give it to you guys right now also. I do actually dance. I'm a salsera and a bachatera, so you guys can go ahead and definitely check him out. Check him out.
Oh yeah, I know how to do this thing, baby.
So I'm definitely gonna go ahead and post my photos. Yes.
Surgery is my side gig. My main thing is like.
Oh, there you go. See, his hips don't lie like Shakira.
All right. Any other question?
Yes. What's the recovery process duration?
Okay, so you had surgery
Tuesday.
So we met you. Then you went to the operating room. You were rolled in. It takes us 25 minutes to do the procedure. Then, if you remember, you were recovering in our recovery area for half an hour. Then we sent you back to your room. And then usually most patients are walking around a couple of hours after surgery.
That's right.
What was your case?
My case was similar. I just started walking a lot, and it was really easy and simple. It was nearly painless.
So how was the discomfort level? What did you feel?
The discomfort level was very low. It was more of, I want to say more of like gassy. That's it, the gassy.
Yeah,
feeling.
and most patients, they bring in their gas X stuff, like thinking that it's more
Mental.
than anything else. Truth is, because we use CO2 or carbon dioxide to inflate the abdomen to lift up like the tent inside so we can work in there, it leaves a little bit of a lingering irritation, but our surgeries the exposure is very low because we use half the typical pressure of CO2 in the abdomen than the rest of the industry, and the surgeries are extremely quick. So basically, as soon as you start walking around, that slowly dissipates. Any nausea after the surgery?
Very little, just discomfort, not too much.
So then we discharged you the next morning. You went back to the hotel. Did you do any activities after that?
Walked a lot more. I sure did.
All right.
I walked a lot more.
Cool. And so as The surgical approach is basically extremely small incisions, and if you don't expose them to the sun, they tend to disappear. So sometimes folks will ask, what about a single incision? Look, a single incision is around this size because you need to stick several instruments, and many surgeons are not that talented, and you want to remove their thumb, make a thumbless surgeon, so they stick 4 instruments and they're just fighting in there with swords. It's easier to use really small incisions, and if you don't expose them to the sun, take care of them, they're going to tend to disappear. Any other question? All right, wonderful. Well, I'll always ask questions. Do you have a question? All right. Our staff up front has a question. All right. Okay, wonderful. All right, so we can't wait to see. So what's your handle on Instagram?
My username?
Yeah.
It's Reinita1414.
All right, so we're going to post that after this video. And guys, keep on watching. Always ask questions and follow us on our Facebook and Instagram feeds.
Thank you.